Improving primary care access. A medical home is not a building, house, or hospital. Instead, it is a partnership with you and your primary care clinician. He or she works to understand you, your family, and your community in order to give you the best primary or specialty care, health education, long-term care, family support, or other services if needed. Establishing a medical home begins with finding the right clinician and then depends on being able to see that clinician at a time that is convenient for the patient.
The goal of the Access Project was pretty simple. It's to give patients access to the physician at a time that's convenient for the patient. We have patient satisfaction data that tells us that access is maybe one of their most important drivers of patient satisfaction. But if we drill down further, it allowed us operationally to align demand for our services with the capacity that we have, and it helps us staff physicians and other clinicians at our clinic sites. And I think the next part of that reason for why is it helps us standardize our processes. We have a number of clinics within our system, and we needed to find ways to make these processes seamless and standardized across all of our system.
What does access mean to our patients?
I think number one, access is I have a need, I have something hurts, I've got a concern about myself or my child, and I need someone to help me look at this or resolve a concern that I have. So at the most basic level, it's access to a provider. And I think what we've learned is it's not enough just to have that access. Ideally, it's access to that physician who they see normally. They're kind of their medical home, someone who knows them. So having them have the access as well as the physician of their choice really was the most important thing. Well, now that we've set the goal of giving patients access to the physician of their choice on the time of the day or where that's convenient for them, we need to step up and meet that expectation. I think it's fair to say we're not nearly at our goal. We'd like to reach a goal where 90% of our patients can call in and have time of their choice with the provider of choice. We're probably closer to 30 to 40%. So obviously reducing that gap is going to be important to us. And the good news is the demand for our services is pretty high. That's reassuring. We just need to find ways to provide enough physicians and clinicians to meet that demand.
Listening to the voice of the customer, a patient's opportunity to impact change.
And it was kind of fun to hear comments when a patient might call and say, I'd like an appointment, and rather than saying, well, what day next week would you like that, it's what time today would you like to come in. That was, to get those reactions was kind of cool. But I think then beyond that, it's really turned, I think, our clinic practices around what are the needs of the patient instead of how do we organize and deliver our services. It's really helped us focus around what do our patients want versus what's easy for us. Process-wise, we're finding what we need to do at all our clinic sites, and getting those standardized has been really important. The Press Ganey Patient Satisfaction Survey tool is going to be real helpful as well in giving us feedback on what the patients are seeing with this. I think it goes back to changing the way we think about delivering our care to what the patient is asking or expecting from us. And I think focusing on the voice of the customer and getting their feedback, it's allowed us to really revisit how we schedule, how we deploy physicians and other clinicians in our clinics, and it's revolving around the patient.